Hello, everyone, and welcome to this week's episode of Toast and Topics. We hope that you all enjoyed a restful holiday season, got to spend some time with family, and most importantly, got to catch up on episodes of Toast and Topics. We're kicking off our 2025 season with an interesting episode that's focused on healthcare in the United States. Healthcare has been topical recently, and Sachin and I wanted to do an episode on this and have wanted to for a while. So, with this issue now being so salient, we thought that now would be a fine time to do so.
Yeah, that's right. And I'm really excited to dig into this topic. Healthcare and economics are more intertwined than it may appear on face value, and I always find it fascinating to draw linkages between the two subjects. But before we get into the topic, we also wanted to take a moment to express our thoughts and prayers to those listeners who are currently in California or have in some way been impacted by the devastating wildfires that are raging across the state. We'll include a link in this episode description to donate to the cause for any of our listeners.
Yeah, amen.
So, back to healthcare. In this week's episode, Ben and I will break down what the healthcare ecosystem in the US looks like at present, what health outcomes are like in this country versus others, and how our system compares to those that are implemented in other countries, and ultimately ways in which the US healthcare system may benefit from potential reform in the years and decades ahead.
Yeah, exactly. For many years, the cost and quality of the American healthcare system has been one of the most prominent issues facing everyday Americans. It's a top policy concern for voters, and it's also a key driver of government spending and, in turn, debt. So, to start here, Sachin, would you like to talk a bit more about healthcare's importance to the U.S. economy and the health outcomes the United States has as a country?
Yeah, so healthcare plays a massive role in the American economy. At present, healthcare spending in the US is valued at 18% of GDP per year, and that's a hefty increase from 5% of GDP per year in 1960. This has meant that on a per person basis, healthcare spending in the United States is the highest in the world at roughly $15,000 per capita. The second highest spender by comparison is Switzerland at $10,000 per capita. Now, this in and of itself isn't necessarily bad. Rising spending on healthcare to some extent should be expected with an aging population that requires an increasing level of care. And if the healthcare interventions that are being paid for are, in fact, improving health outcomes, then that spending may be worthwhile. But the data that we've seen on US health outcomes over the past several decades has not been especially impressive or encouraging. For example, the US has some of the highest levels of infant mortality among developed nations at roughly 6 deaths per thousand live births. It has among the lowest life expectancies, and its rate of preventable deaths per 100,000 people is more than double that of the top performing country, which is Switzerland. Switzerland, ironically, is the second highest spender on healthcare per capita in the world, as we just mentioned, but its comparatively excellent health outcomes are in line with that spending.
Healthcare works differently across the world, but I think the one common denominator is that it is quite expensive, even if it's more expensive in the United States than elsewhere. The cost of medical procedures in the United States varies significantly based off of factors such as the type of procedure, the healthcare facility, geographic location, and insurance coverage. And one of the big issues is that there is limited price discovery. But just for some perspective here, X-rays and MRIs could cost anywhere from $300 to $3,000 in the United States. C-section for childbirth is nearly $4,000, and major surgeries such as a heart valve replacement could set you back over $170,000. I know this is a bit cliched, but I think with some of the statistics you just mentioned, Sachin, we've seen kind of proven the old adage that the United States spends the most and gets the least with respect to its healthcare, at least among developed countries.
Yeah, at least in aggregate, I think that's right. But there are some nuances in how the US healthcare model works that would be helpful to discuss.
All right, sure. Tell me about them.
So, expanding on the topic of cost, the next logical challenge in healthcare is who pays for these expensive procedures. And this varies across the world, which is where the concept of insurance comes into the picture. The system in the US is especially complex with a combination of publicly financed government health insurance for some parts of the population, which coexists with private health insurance plans for another subset of the population. And this system confuses a lot of people around the world. Um, on the public side, we have both Medicare and Medicaid. Medicare is a federal program that provides health insurance primarily for people above the age of 65. And Medicaid is a joint federal and state program that's focused on providing health coverage to low-income individuals and families. For context, about 20% of US citizens rely on Medicaid and 14% rely on Medicare. On the private side, the majority of individuals receive private insurance coverage through their own employers. Almost 50% of the US population is insured this way, and another 6% receive private insurance through health insurance marketplaces where they basically look for plans on their own. So tallying up the totals across each segment, that gets us to about 90% of the American population that has some form of insurance. But that means that there's still almost 10% of the population who live uninsured, and that equates to nearly 30 million people. And that's a pretty staggering number for a country like the US. And it's a high number in percent terms compared to most other developed countries.
Yeah, that is interesting. And it does raise the question of whether access to healthcare should be a right for everyone, or if it should just be something that the 90% of the population with the financial means to do so can enjoy. There really is a large portion of the population that does not have access to affordable care. Of course, those living in poverty are one example. But there are also many middle class individuals who are self-employed. They may not work at a large company that provides insurance, and they may not want to spend on premiums on their own, which could add up to tens of thousands of dollars for a family at non-employer negotiated rates. For many people, living without insurance may prove to be fine if they are never hospitalized, of course, but that's an exercise in risk management. In the event that you are in need of care without health insurance, you would be forced to pay the complete cost for care, including what insurance companies would normally pay out of pocket. In 2022, total out-of-pocket spending for healthcare in the United States was 471 billion, which accounted for 11% of total healthcare expenditures. And this really does have large economic consequences. Uninsured individuals often may not be able to pay for treatment and are therefore more susceptible to accumulating debt. A survey found that nearly half of uninsured Americans reported challenges in affording their care, which is more than double the share of those with private insurance. That's not exactly surprising here. And nearly 41% of adults have some form of debt caused by their own or a family's medical or dental bills, which, really just speaks to the economic gravity of this situation.
Yeah, those are some interesting stats, Ben. So clearly we need private insurers because of the cost of healthcare being so high in the US. But it really raises the question in my mind on what exactly drives up the cost here so much versus everywhere else.
Yeah, healthcare spending overall is driven by utilization, the number of services, the healthcare sector that are being used, and price, which is the amount charged per service. What's interesting is that despite spending, again, nearly twice as much on healthcare per capita, the utilization rates in the United States do not really differ from other wealthy OECD countries. That's the per capita comparison point. Prices, therefore, appear to be the main driver of the cost difference between the United States and other wealthy countries, which then raises the question, what is driving these prices higher? There are a few reasons. Number one is a lack of price regulation for drugs and medical procedures. In the United States, pharmaceutical companies are able to set their own prices, which do not have especially strict regulations or caps as compared to other countries. For example, insulin can cost hundreds of dollars a month in the United States compared to anywhere between $10 to $30 in countries like Canada or Germany. The prices of procedures like MRIs, surgeries, and hospital stays are also much higher in the United States due to this lack of standardized pricing. Administrative costs are also a major issue when it comes to the price of healthcare services here in the United States. In our healthcare system, are seeing a high amount of fragmentation. There are many insurers. Some are private, some are from the government, and some are from employer-sponsored plans. And it just takes a lot of admin to navigate that really complex system. Billing, insurance claims, and other administrative activities account for 8% of total healthcare spending in the US, compared to around 1 to 3% in countries with single payer systems. The fee for service model that we have here in the US is also oft discussed with respect to the high healthcare prices that we have. Providers in the US are often paid based on the quantity of services that they deliver rather than the quality of the outcome. On top of this, many hospitals, insurance companies, and pharmaceutical firms operate for profit entities. They operate as for profit entities, that is, focusing on maximizing revenue. And so it's really kind of an issue of misaligned incentives here. These companies have really every incentive to charge high fees for their services, whereas as a society, we might want those fees to be as low as possible.
That's pretty illuminating. And this is clearly a problem because many private insurance companies also have the power to deny care to patients based on a procedure by procedure basis,
Hmm.
as well as for providers that might be out of their network, which creates a lot of additional complications when you think about actually accessing affordable care in this country. Um, and another small point that I just thought of as well is that when people who live uninsured finally do seek medical care for whatever it is that they might be looking for, they most likely arrive in the hospital even sicker than they should have been because they didn't seek the care that they needed earlier.
That's true, and this raises the question of what other systems are out there, specifically universal healthcare. I know that you've done some investigation into how this alternative model compares with the model that we have here in the United States, Sachin. And so, do you want to spend some time discussing that now?
Yeah, a lot of the lagging performance of the American healthcare system has to do with access to care and equity of care, both of which are heavily influenced by the availability and the quality of private insurance as well as private providers. Um, Universal healthcare refers to a system in which all individuals within a country have access to healthcare services without financial hardship. And it's based on the principle that healthcare is a fundamental right and should be available to everyone, regardless of income, employment status, or any sort of pre-existing conditions. And there's a few different flavors of universal healthcare. There's the single payer system, where the government acts as the sole insurer, covering healthcare costs for all residents. And for example, this is what happens in Canada and the UK. There's the multi-payer system, where healthcare is funded through a mix of public and private insurers, such as Germany and Switzerland. And there's also a public-private partnership where the government provides a baseline level of care and private insurance actually fills in some of the gaps. This is what happens in Australia as well as the Netherlands. There are some clear and unquestionable benefits to universal healthcare. The first, of course, is access to care. It ensures that everyone, regardless of their socioeconomic status, has access to healthcare, and that ultimately reduces disparities in health outcomes for marginalized groups. The second is that it lowers costs. Centralized systems have much better negotiations of drug prices, medical services, and equipment costs, and that often leads to reduced spending overall. And as a result, administrative costs are much lower, as we talked about, in single payer systems compared to a fully private insurance-based system like in the US. And third is just overall improved public health. You know, if people are seeking healthcare more proactively, it will lead to earlier diagnosis and treatment of various conditions, and that will prevent more costly advanced stage care. This can reduce the spread of diseases, and it also has an economic benefit here. Healthier populations can contribute more effectively to the workforce and increase
Mm,
productivity of countries over the long run. But as with any model, universal healthcare isn't perfect. The first clear drawback of the system is longer wait times as well as supply and demand imbalances in the healthcare system. In countries with single payer systems, demand for certain services, for example, elective surgeries, may outpace the supply of doctors that are actually providing them. And that leads to long delays. Free or low-cost healthcare can lead to overutilization, where patients basically seek care for minor issues or non-urgent problems, and that clogs the system. And governments in universal systems often regulate prices for medical services and
mm.
procedures, which can limit the financial incentives for providers to expand services or work in certain areas. And that can result in some pretty serious supply-demand imbalances, which ultimately leads to many doctors in universal systems being overwhelmed for not enough financial incentive. The second thing I'll mention is limited choice and more limited innovation. Large-scale government involvement can certainly result in inefficiencies, red tape, and mismanagement, and reduced profitability for pharma and medical device companies might ultimately discourage investment in research and development, which some might argue may not actually create better health outcomes. And I think that's one of the key benefits to the American system of healthcare is really the scale and speed of innovation. The US spends an estimated $200 billion annually on healthcare R&D, which includes pharmaceutical development, medical devices, biotechnology, and other health-related research by public and private institutions. And this accounts for almost 45% of global healthcare R&D spending, which makes the US the largest contributor to global innovation.
Yeah, that is really interesting, and it's a helpful point because I think when people are looking at our healthcare system, they often point to the shortcomings. But that spending on R&D and then the technology that ultimately flows from that is really quite helpful and game-changing in many ways. Overall, I think it's clear that there's not really going to be a silver bullet that is able to improve the American healthcare system. But nonetheless, I do think it's clear that we do need to make strong efforts to ensure that more people are able to get access to care and to also reduce the costs of providing that care. Sachin, in spite of all of the shortcomings that you just listed with respect to universal healthcare, I do want to conclude this episode by outlining some potential ideas for improving the American healthcare system. The first of which is to, I think, make some more concrete steps towards some kind of a universal healthcare or expanded health insurance model. The basic problem here is that there is simply a lack of care and access for uninsured or underinsured populations, and this can cause people to neglect healthcare early and then ultimately it can lead to crises that drive up emergency care costs. And so I think that there's a real possibility that by expanding the scope of the care that we are providing, we could drive down health costs in the long term for Americans. The second reform that I think would be quite helpful would be to reduce administrative costs in our healthcare system. We've already discussed that administrative costs for healthcare are some of the highest in the world in the United States. And these costs are not even being put toward funding care for patients so much as they're simply being used to navigate a rather Byzantine billing and care approval system. And so we really should aggressively look for ways to cut down these administrative costs. For example, it could be extremely impactful to make healthcare records interoperable, meaning that they can be accessed across a variety of hospitals and providers to reduce friction when transmitting information. And then perhaps also we could potentially establish a single payer system in which there really is no ambiguity about which entity is shouldering what part of a given patient's healthcare costs, which consumes a huge amount of administrative personnel right now. The third reform is a pretty basic one, but I think it's just extremely important that we emphasize preventative care. Chronic illnesses are major drivers of healthcare costs, and they're often, frankly, preventable with early intervention. And simply by increasing investment in prevention via routine screenings, vaccinations, and wellness programs, and potentially through the use of these new obesity mitigating GLP-1 type drugs, we really could reduce the incidence of chronic illness among Americans, which really are immensely expensive. It's also important for the United States to invest in interventions outside of the healthcare system per se to address the social drivers of healthcare or healthcare costs, that is. Poverty, homelessness, hunger, discrimination, gun violence, substance use, and things of that nature all ultimately do lead to worse health outcomes for people. And they are things that it really will be helpful for us to take steps towards addressing. And then finally, I think that an overhaul in pricing and how services are provided in the healthcare sector could be quite useful. The U.S. healthcare system is fragmented. It lacks standardization. Prices are negotiated individually between insurers and providers. And as we've already discussed, that leads to really significant price variability. The cost of the same procedure can vary by thousands of dollars between hospitals, even in the same city. And patients often face surprise medical bills due to out-of-network charges or undisclosed fees, which further exacerbates this problem. And so the solution here would just be to centralize negotiations for healthcare services such that buyers of services and then ultimately patients can negotiate from simply a stronger position that can drive down costs for these consumers of healthcare.
Well said, Ben. This has been a really fascinating conversation. And if I had to summarize again, there's no perfect system at the end of the day, but it's clear that there's a lot of opportunity for change in healthcare. I'm sure that there will be a lot more discussions on these solutions in the months and years ahead, as we've seen over the past many years as well. So I'd love to do more episodes on the intersection of healthcare and economics in the future, just like this one. And for our audience, if that's something you'd want to hear more of, we want to hear from you.
Well, thanks everyone for joining us, and we will see you next time where we're going to return to the topic of trade policy. There are really fascinating debates raging between economists and policymakers right now over whether the United States should increase trade barriers with the rest of the world. And we'll be doing our best to cover both sides of this debate in the next episode. So until then.
Thanks for listening to Toast and Topics. Before signing off, we wanted to disclose that the views in this podcast are our own and are not reflective of any institutions that we're associated with. If you like what you heard, please rate, review, and share with a friend or family member. We'll see you again next time.